from here down to the right of the spine.
Mostly to the right.
Yeah,
How long has it been going on?
a few months.
Got it. Ever have a history of back trouble before?
Yeah.
Okay.
Been here for that.
Yeah. Okay. Anything bringing that on in particular, or just kind of develop?
I just kind of started.
Okay. Any associated trouble with pain, weakness, tingling in the legs?
No.
Got it. Disturbing your sleep at all?
At times, if I turn in the sleep, I get the twinge and it wakes me up.
Got it. So that's not good. We need to get you sleeping good, right?
Yeah.
Okay. Fair enough. All right, what I'm gonna do is I'm gonna just observe movements in different directions. We're gonna take notice of how far you move each of those directions and what that response is like for you. We'll compare that to after the treatment to see what kind of effectiveness we can notice in the short term. Fair enough?
Yeah.
All right. Sounds good. For this, if you don't mind, I'm gonna be turning face towards me. So the first thing I'm gonna do is just reach and bend forward to touch the floor. Just gonna take notice of how far you go. Any bother with that?
No.
Forward bend is pretty decent here. Come on up. You can almost touch his toes. Attaboy. So the next thing is, I'm going to take your left hand, slide it down the side of your left leg, see how much you can bend to the side, and come back up. That looks a little stiff there.
Yeah.
If you don't mind, I'm going to have you do that one more time and kind of see what that looks like here in your back. Can I bring this up a bit?
Sure.
I'm tucking your shirt there. You okay to untuck your shirt? Thanks. Go ahead and bend to the left. And come back up. She's kind of struggling to get there. It's not easy. Bend to the right. And certainly less easy that way. Right? I mean, anybody can notice that, right? And now see what it's like to bend backwards. Not exactly going to do the limbo anytime soon, is it? No. Okay. All right. Okay. How about down here at all?
Not too much.
So we'll focus our intervention this
Mostly
area.
like from here down.
Fair enough. So the first thing I'm going to do is I'm going to use an alcohol pad just to clean the skin. This is a clean technique. This is not a sterile technique. Perfect.
Even though I'm not gonna feel it, don't tell me you're sticking a needle in, because I have a tendency to anticipate and jump.
All right. So I won't tell you when, but he probably doesn't want to see them, but if you can, these are really tiny in terms of diameter. Barely see that.
Oh my God, what is that?
So then we just think about good places to treat this, and right off the side of the spine. Just tap that in.
Go to the other side too.
How'd that go? What's that?
I was just letting them know if they wanted, they had a better view on the other side. You guys can see to where I come over.
The particular heads on
How
these.
far in does it go, or does it depend upon the person?
Depends on the person. Like, I'm gonna know his spine, so I chose. You're probably going in on these, maybe up to 50 millimeters. It's a little flinchy there. That area is sensitive. He's like a champ though.
You feel anything, Jim?
A little bit.
Just a little?
That one that I flinched on, that one hurt, but the other ones.
Hey Jim, we saw your name in the Herald a while back. Did you catch that article? That was awesome. Just another day, right? Work.
Another damn paradise, yeah.
What was it for?
So they were reviewing, something that happened in the newspaper a number of years ago, and, like this date, 25 or 30 years ago, it was in the Herald. It was an article that appeared in the Northwestern, I think, about, you just happened to respond to a call, and was it enter some sort of building? Was it a burning building?
Yeah, burning buildings,
You saved like a couple people?
Oh,
Is that right?
yeah.
wow.
That's impressive.
Well, no, I have to say that the one that's just about at the kidney on the right side,
Right here?
yeah, that one's twitching.
It was twitching, so are you okay hanging out with that, or is it like?
Yeah.
You okay? Yeah, when I put
It's
it in,
just that,
it twitched quite a lot.
yeah. It still is.
You can have 12 needles to begin with. I mean, Jim's a pretty robust guy. And there's a widespread area of muscle tension I can see and limited movement in there. So I think he'll do really nicely with this treatment.
How much does it cost to get 12 needles?
How much do the needles cost, or how much does it cost to the patient?
Yeah.
I'll make it closer to one. Which one? Excuse me.
So, you're one of the patient cost? Yeah, so right now it's $29 per session. In 2021 it was $75. We reduced the price, more people could have access to it.
I thought it was just, what, it was $29 per needle.
Oh, it's for the treatment.
Really?
We're likely going to increase the rates fairly soon.
That means I better get it soon.
Yeah, that's with an addition to like a therapy session.
Yeah, but it's like $29 a needle, and for 5 it's 100. That's what someone told me.
We have a option for like a 4-pack discount. So that 4-pack means you purchase 4 dry needling sessions at a discounted rate.
So not for the fun stuff,
Okay,
electrical
you're confusing me.
stimulation. You turn this up a little bit, let me know when you
Doesn't
first
need to just
start to
use it
feel
as
it.
like one group. So if they need 8 or 20, would be the same price, correct?
Ah,
Just pay per session.
I think
Does
I'm
that make sense?
feeling
that
it
feels
now.
better.
For time.
For time, yeah.
On the left side, correct?
Yeah.
We could turn it up to a real high level, but you don't need to. Sometimes you want the muscle to get really twitchy. In this instance, first session, we generally want to just kind of test the waters. Get used to it. Feel a little bit there on the right side?
Little. Not as much as on the left.
What now?
Oh, yeah, there you go.
I can see it.
There you go.
Twitching a little bit. All right. So we're setting up for about 15 minutes total. Should have a good response then. So again, treatments are going to be in place for a little bit. We leave them with if we're going to leave the room, we'll leave them with an alarm, timer. We have a needle count going in, needle count going out, so he doesn't leave with any extra needles.
It's like, I know there was one more needle.
So these muscles are in what are called the paraspinals, or the muscles along the spine, and they can also, those could go a little bit deeper and go on to the actual bony bumps of the spinal vertebrae to get an added benefit. Sometimes it can be really helpful. At times we'll put some on the outer portion of that muscle too, and we direct it inward, so we don't have to worry about going between his ribs and puncture his lung. That would be a bad day. So we're going to assess after he's done with this, we're going to assess his mobility, right? And I predict there's a reasonable chance he's going to have increased ease and mobility with less pain. We'll get a chance to see, we'll get a chance to know. And even if he doesn't have that response, we might still decide to do another session or 2 of this, but there's a decent chance he's going to notice an improvement. This, of
You
course,
have them in at different depths, is that Like this last one isn't in as deep as the other ones. Is there a reason for that?
When I first put one in here, it was pretty tough
Tight.
and tender. And then he said, "Oh, that one's really bothering."
Okay.
I went one lower.
And
So,
that's
you know,
where his pain is anyway.
I kind of want to treat the area, but I don't want to wall up it
Okay.
too much, right? Because he's a tough guy, but this area is obviously very sensitive, and don't want to light it up.
Okay.
So there's an optimal treatment dose. Sometimes if you go over that, it's not a good thing. So like water is healthy for life, but you can drown, kind of thing. There's this optimal treatment dose. It's a good question. Again, dry needling and isolation may be helpful. We've had some patients come in and just try to get dry needling. Generally not effective alone, as much as when it's integrated with a plan of care, because we know that hands-on work is really effective. We know that exercise prescription is really effective. We know that moving people through a continuum of treatment in which we work to decrease sensitivity and inflammation is the first step. Second step is to correct some of the root causes of the problem, which is usually joint tightness, muscle imbalance, postural problems. And the third stage is where we're attempting to increase the strength of the muscles and their newfound flexibility. The last stage of recovery is increasing overall strength and durability so that individual is a more robust, strong human being that's capable of doing more things, less likely to have an ongoing injury with that. That's where the real value of it is. So early on, might use dry needling, but could use it through the whole treatment time if that's necessary. In knee arthritis, if someone chooses to use dry needling, we definitely want to continue to use that. Oftentimes, in some other cases, we'll maybe use it for a portion of the time that they're in the plan of care. It all depends. Some patients try dry needling, they're like, that's the best thing ever. I want it every time. Right? But again, this is a means to an end so that he can move and function better. There's one woman who was coming to us for a while because she was getting no results with cortisone injections and in her knee, and the Synvisc injections were very expensive and not necessarily well tolerated either.
I had those when you had that 38.
I'm sorry?
The Synvisc, didn't at one point you have to have 3 of them?
I'm not sure if that's true or not.
No, I thought that's what that was when I had it. It was awful.
That might have been what the research was at that time. But
Yeah.
anyway, that individual would come in every few weeks to have it done. It really helped her quite a lot. But most individuals, they receive a treatment within the time frame that they're in therapy. Some individuals with maybe problematic areas might some treatment on an episodic basis every 4 or 5 weeks. But most individuals, once this calms things down, they can get moving better. We've got a good exercise prescription that they can follow. The nice thing about being in the profession that I am is because we get a chance to use some of the best approaches and then combine them. So we know that hands-on work is really helpful. Everyone knows, oh yeah, massage feels good, right? Well, there's a lot of ways to relieve pain, right? I mean, we can have a drink, we can be in a hot tub, we can get a massage. There's lots of ways to get some pain relief, right? And that's really necessary as a portion of it, but it's not the means to the end. The means to the end is to have increased ease of mobility so that we can restore that normal flexibility. Jim's mobility and backward bending is not very good, right?
Me either. I'm like,
That's not that unlike a lot of folks, but I think Jim is probably more active than the average guy his age, right? I don't know if you still help out at camp?
Yep.
Yeah. So he's doing some vigorous work, and he needs his body. He's up on his feet. You're probably still doing I think I saw you at once at the Grand. You're still helping out there, right?
Yep.
Yeah, so he's doing a lot of stuff in the community yet, right? So his retirement isn't hopping on the bingo bus and going to the tavern every day. Although he might do those sort of things, he does much more, he does much more than that, right? And that's great. Like, he should be active. That's what we're after. But in order for him to be that active and not start to succumb to some of the things that happen to individuals as they get older and older, is he needs to maintain his mobility and strength.
So as a doctor, are you prescribing that I go to the tavern more?
Only if you invite me ahead of time. So. Questions, comments as we continue here?
What do you feel,
I
Jim?
haven't had a drink for
What?
5 years.
Or
Yeah.
What are you feeling?
I'm
Anything?
just feeling the twitching, yeah.
So he's feeling
In my
twitching.
back.
I don't, maybe see a little evidence of
Well-
twitching here. See these wires move a little bit.
Yeah, it feels like it's twitching.
I agree.
yeah, see that middle.
These are simply clips that go on those needles. This is a battery operated unit.
So you could do it if you don't have electricity. Just with a flashlight.
You could.
Yeah, we had a clinical day like that once.
Really?
One of those spring storm days where the power went out. Yeah, it was pretty
Mm.
wild.
And you must have daytime light.
Sent someone to Menards to get some those lights.
I'm trying to think, I don't even know if I was here during that time.
So we pull these out. Create a little bouquet of these. Ooh, that was a sensitive one.
Yeah, I know.
Don't give it away.
Captain Obvious, right?
It's so weird he didn't react to any of the other ones.
So I suspect at that area there's probably a significant spinal dysfunction that needs mobilization and manipulation. Maybe some deep tissue work.
Yeah, and the nerve right there. It's redder there too.
And just if you don't mind staying here for a moment, what's that?
Okay.
So, not sure if you notice anything without moving a whole lot before and after that as of now.
What do you mean?
What do you notice that's different?
I feel shorter.
You feel shorter.
Oh, that's how that happened.
Wow. Good to me, actually. Looks like he's staying a little bit taller, but
Oh.
maybe that's wishful thinking.
He looked more limber getting up.
Yeah.
Go ahead and bend forward, please, and touch the floor.
Oh my.
Boop. Just like that. Right.
He's closer.
It's closer.
Nice. So we're starting to do the happy dance, right? And he's started to do really well. I'm gonna side bend this way. A little more mobility there. I think last time we went right first.
Yeah, that is for.
This is not a natural movement for people to do, but he knows to get a little further, he's gotta bend a knee, so we're not where we need to be. That's a much different spinal movement. You're okay, you're all right. Now bend backwards. I'm not sure he's gonna be my limbo partner quite yet, but,
Right. But
looks a little bit different,
start
right?
it, yeah.
He's gonna at least be able to pass the first round, maybe. So hopefully he's next
Get
round.
on, then I go to bar.
So do you notice a difference in terms of those movements?
It seems a little bit, like, I think I go back further. I know I can go forward further.
Right. And generally with spines, you wanna keep and maintain and improve backward bending as much as possible. Side bending of the spine allows your spine the capacity to do more backward bending, because otherwise you start to get more and more forward as you age, if you don't do some flexibility stuff. Some of that is some natural age-related stiffness that does occur.
Yeah.
And some of that is just habits. We don't do a lot of overhead stuff. We don't do a lot of flexibility stuff. But that's a good outcome. So I'd say that's a favorable outcome, and we'll chalk that up as another 5+ ish minutes miracle. So thank you so much, Jim.
Sure.
Appreciate it.